snake venom. Now, classification of poisons is completed. Now let us discuss about duties of registered medical practitioners in cases of suspected poisoning. Registered medical practitioners are as doctors. It has both medical and legal responsibilities. Medical. We should take history of the patient. We should ask questions such as quantity of the tablets or liquid consumed, time of consumption, what tablets or liquids consumed, which means what type of poison you have taken. These are the questions you have to ask the patient if we suspect that the patient is having taken the poison. Symptomatology. Quickly analyze the symptoms and diagnose the poisoning. Treatment. Doctor should not allow anyone except hospital nurse to administer medication and nourishment for the safety of the patient. Doctor should maintain written record of his findings and treatment that is useful to the physician in the court. Legal. Responsibility of the doctor in suspected cases of poisoning. Preliminary data. Personal data like age, sex, identification marks of patient should be written. And he or she, the doctor, should inform the police. If he is a private doctor, he should inform only about homicidal poisoning. There is no responsibility for him if the condition is suicidal and only one person came to the hospital. He can maintain professional secrecy of the patient, and if he is a government doctor, police officer of nearest station should be informed about the cases of homicidal, suicide, accident or any accidental poison. Any kind of poison, if he is a government doctor, he should inform to the police officer of the nearest police station. Whereas private doctors, there is no necessity. He or she should inform only if it is a homicidal poisoning. Collect and preserve the following as evidence: vomitous, stomach wash, contents and samples of urine or feces or and suspected food or drink or medicines in separate glass bottles which are labeled with name of patient, material, reserved date and time of examination, kept under his custody until it is handed to police officer for chemical analysis. Death certificate. If the patient dies, he should not issue a death certificate, but he should inform the police and hand over the body to the police officer for further investigation. Public health authorities must be notified in cases of mass food poisoning arising from canteen or mess or hostel, etc. These are the duties of registered medical practitioners in case of suspected poisoning. Contraindications for gastric lavage. Gastric lavage is contraindicated for certain poisons. These are the contraindications of gastric lavage. All corrosives except carbolic acid are contraindicated. That means except carbolic acid, none of the corrosive poisons, none of them, in those cases we should not perform gastric